Hi guys, good evening. If you are in United States of America, good evening. And if you are in Philippines, in Asia, mabuhay and good morning. So we are here for Thanks God. It's Thursday. Another great day to interview our entrepreneurs, innovators, therapists, and academicians. So I am your host. I'm Dr. Jenny Yusuf, physical therapist and Dr. Physical Therapy. I'm a founder of Balanced Fall Support Group, where we usually air this, and also the president of Physiogen PT and Wellness. So I am a certified exercise expert and geriatric mentor and coach. So if you have any questions and inquiry, we can always ask some speakers to get to know more and then learn more from them. And we have an opportunity for tonight from Omnitherapy based in New Jersey. Ana Pozzolli. Ana Pozzolli is a physical therapist and she's a certified lymphedema therapist. She's one of our expert speaker in the recent lymphedema workshop conference summit we did. So thank you so much, Anna, for that wonderful speaker engagement and also learning opportunity. All right, without further ado, guys, we have Ana Pozzoli. Welcome, Anna.
Hi, how are you? Good evening, good morning, wherever in part of the world we're seeing this. Welcome, everyone. And thank you, Dr. Jen, for giving me this opportunity to participate and provide some information.
You are welcome. So tell us more. You're based in New Jersey and you are the owner and co-founder with Oscar Pozzoli for your Omnitherapy clinic, where you are treating lots of lymphedema clients, lipedema patients, and more. So tell us more about your field. Go ahead, Miss Anna.
Yes, so thank you. We are located in Bloomfield, New Jersey. Our center is called Omnitherapy Center. And I have worked with my husband for 20 years as the owners of Omnitherapy Center. Prior to that, believe it or not, I even worked for the previous owner. But upon taking the ownership of the facility, we made some major changes. We do work with orthopedic patients, but at that time, I really wanted to expand my knowledge on the lymphatic system and work with lymphedema patients, knowing that not many patients were being serviced in this area as a result of just lack of therapists that provide this. So we have been doing this for 20 years. My husband has also become a certified lymphedema therapist. And Oscar also has great knowledge about wound care, as he did that in a hospital setting prior to us becoming the owners of Omnitherapy Center. So Bloomfield, New Jersey is in the northern part of New Jersey, but we service more than just this vicinity here. We actually see patients from other states like Pennsylvania, New York, southern part of New Jersey, just because we have this niche of physical therapy that is lymphedema related.
Yeah, that's just really very helpful. You know what? As I've said, I have a colleagues and lots of therapists in New Jersey, and they are more on focusing on orthopedic, as you've said, and also geriatric. But it's good to know that there is a lymphedema specialist, in that particular area. So as a certified lymphedema therapist, what will be your challenges and wins that you can share with us? First, just tell us a little bit brief to all the listeners who are not familiar what is lymphedema. Then share us some of your wins and challenges, Anna.
Well, yes, lymphedema is it's a disease that can come in so many different ways. It could be because of treatments of cancers. It could be due to obesity, related to other issues such as vascular issues, and some patients are also born with lymphatic disorders. So we have primary and secondary lymphedema. And then at the end of our conversation, I can share more. But the fact that we are able to make such a difference, this is our biggest win in our practice. that when the patient comes in and they have been to so many doctors, and many times they go underdiagnosed or not even diagnosed properly because there's not that much knowledge about the lymphatic system. So when they come to us finally with a proper diagnosis and recommendation for treatment, we start the treatment, which consists of, four components, which is the manual lymphatic drainage, which is, I don't want to call it a massage. It's a technique that we do to actually mobilize the lymphatic. We incorporate skin care, which is so important to keep them from having wounds or cellulitis. We also do the bandaging with the patients in order to reduce the swelling that they may have. And keep in mind, this could be lower extremity, upper extremity, sometimes facial edema. It all depends what the root cause is. And then also we have to incorporate remedial exercises. And for yourself being an exercise specialist, there are certain types that we do in order to actually get the lymphatic system to move the fluid that is stagnant, whether it's in a leg or an arm. So seeing, a patient come in very emotional and not knowing what to do, or haven't had this for years and no way of controlling it, and all of a sudden, it is our job to reassure them that, okay, help is on the way. So for them, it's a big relief. For us, it's satisfaction of knowing that we got this, we can do it. So, as soon as we start, we do the evaluation first, get all the assessments, and afterwards, when we start, by the second visit, it's a dramatic change. And that is the best part of what we do with our patients. So I always say that we develop this friendship with our patients because many times lymphedema is chronic. So these are repeat offenders, as I call them. And so if they don't follow the rules, or sometimes other things can happen, the lymphedema can get out of control. So what we do is, we establish a protocol where we see them after their discharge. Okay. So I have to say that that is one of the wins that working as a lymphedema therapist, and even with our orthopedics, same thing,
Yes.
The things that are not such a win, that are the main challenges, of course, I think with every physical therapist can relate to the insurance, the reimbursement, the cap. All of those are challenges in the field of physical therapy. And it does not just apply to an orthopedic client. With lymphedema, keep this in mind, this is a chronic condition. This is going to be with them for the rest of their lives. So how do you justify only maybe 20 visits in the entire year when they have to fight, bouts of cellulitis to, and the legs can get worse, or the arm, or they may have a setback. So our documentation has to be, precise as to what we are doing and why we're doing it. And it's really to keep them out of the hospital. So that is one of the biggest challenge. And then there are smaller challenges, and those are personal to every patient. The challenges are whether they live alone, do they have help, do they have to go up and down stairs, and also their mobility. That is a big challenge because our goal is to get them to wear something that is going to keep them from swelling up. And if they can't reach their feet, that's where the exercise portion comes in that we have to incorporate.
Yeah, that's really true. It's really challenging. Good point that you say something about how they are emotional coming to you,
Oh, yeah.
Yeah, because it's really a chronic and progressive disease. And then without proper management, it's really a tough and it's a battle. That's why it's education is really the main function for us to do this. And also sometimes I keep saying we are not only therapists, like we are like psychologists, that we tell them you can do this, we just need to do this. And they gave up, they gave up because I have a client that she is not really mobile because of the weight of those lower legs, and I
Right.
feel bad. So we are grateful for specialists like you, Anna, that focusing especially in lymphedema. So can you tell us more? You have a wonderful presentation in our recent lymphedema conference, and I get lots of great feedback with that. So thank you so much for being part of our conference and lymphedema last time. So they're asking, now we know what is lymphedema. We're also seeing something that is only fats, or what are the different types of lymphedema and what is lipedema? Because they also hear that. So can you
Right.
tell us a little bit about that, please, Anna?
Sure. Did you want me to share my presentation at
Oh,
this
yes,
point?
please.
Okay,
Yes, yes,
let's
yes.
see.
I believe you prepare something for our listeners. So,
I
guys,
did. So
yeah. So, guys, Anna will going to show us a simple webinar or presentation just to show to
yes.
you.
And hold on one second.
You can share it to screen, things like that.
Yes. Okay. So here we go. Oh, hold on. Share screen. There we go. Are you able to see it there?
Yes.
Okay. All right. So I just put this together so to give a little perspective of, oh, hold on one second. I'm beginning. All right.
Yes. Perfect.
So I'm just going to breeze through some of this. Not everybody's going to become a specialist, so I just want therapists or other healthcare workers that are watching this to be aware what is lymphedema, because so many times you may see it in your clinic. So it is a disorder of the lymphatic system, which is throughout our entire body. Okay. And it's part of our immune system. That's why it's so important to address it, because this is a source of infection if not taken care of really well, where they can develop cellulitis. The swelling usually is in an extremity or body part. So when I say body part, sometimes after treatments of head and neck cancers, you could get swelling in the face, head and neck, and sometimes even in the abdominal area after some of the breast cancer treatments. So it is an abnormal buildup of lymph fluid in the soft tissue, and it can be due to the damaged or blocked lymph system. The damage can come as a result of trauma, removal of lymph nodes, cancer treatment, or sometimes they're just blocked because of obesity as well. So that's one of the things that you may see. And there are different types of lymphedema. There's primary lymphedema, which is patients are born with abnormal numbers of lymph nodes, and it may affect only one leg or both legs. Sometimes you may see it in children, but many times it's the adult population that we see it. Secondary lymphedema is, like I had mentioned before, it could be due to cancer treatment. It can be also part of trauma, and post-surgical, we see it too. You see a total knee replacement or a total hip, and they get that normal swelling of the leg, and it feels a bit congested and almost fibrotic. Any of that edema that has been sitting there for that long, it becomes lymphedema. Also lymphedema. These are the vascular types of lymphedema. So chronic venous insufficiency, they swell long enough, eventually that will also become a lymphatic disorder. And then there is lipolymphedema, which is the fourth stage of lipedema. When the lipedema itself is trapping some of the lymphatics, you may see lymph accumulation, and I will discuss that in a little more detail. So, and then the other, the different type of issue that arises with lipedema, which is a connective tissue disease. With this, it's predominantly in females. It's very rare in males. And in my 20 years of experience, I have not seen a male present itself with lipedema. And what they show is increased fibrotic adipose nodules in their tissue. And it is in the women, you will see it where it can affect the lower abdomen, the buttocks, the hips, and extremities as well. So this is like very asymmetrical. When you look at these women, you almost look like you're seeing two different bodies put together, a small one on the top and a larger one on the bottom. And it usually spares the trunk. At the trunk of the female, you normally don't see this adiposity. The hands and feet are not swollen either. So that's a major difference. So what are some of the features of lipedema? So it has symmetrical lower body adiposity, unlike lymphedema where you could just have it in one, okay? They usually have very smooth skin, but when you feel the skin, it has these subdermal pebble-like nodules, so almost like little peas or pearls that you could feel underneath the skin, and they are very painful to touch, okay? Patients also present with what is called a cuff sign at the ankle. So the upper portion of the calf, the lower portion of the calf, I'm sorry, it almost like a little cuff forms there. And then the foot would be normal. You will see that in some of the pictures. And their legs are like column-like shape, okay? And they also have a small waist to hip ratio, meaning that the waist size, it's a lot smaller than what their hips are. Almost like, doesn't make sense that it should be that much of a difference. Other characteristics of lipedema are frequently painful sensation. So not every patient, but the majority of them will have very sensitive skin. They bruise easily. Most of my patients, if they have a cat or a pet, and they say the pet will sit on their lap, after that, they would have like a small bruise on their legs as a result of it. And because this is adiposity that is in the leg, they try to lose weight, but the traditional diets do not work. They have to really focus on what their triggers are, what is inflaming this fat tissue in order to know how to control their weight. There's a huge component of hormones that are involved with lipedema. This is why many times in diagnosing patients, I always ask, when did this present? Was it at puberty? Was it during childbirth? Sometimes premenopausal or postmenopausal, because of the hormonal component that is involved in the characteristic of lipedema. And it can be inherited. So it's usually, like I said, the females, but it doesn't mean it comes only from the mother side. It could be the grandmother on the father's side can be one of the persons that will pass on the genes. Another feature that they mostly have, they're hypermobile. These are patients that are super flexible, which becomes very dangerous in the end stages of their disease, because now not only do they have large legs and a heavier weight, they're hypermobile. So the instability of their joints, making them so vulnerable for falls and balance issues. So, you know, that is one thing that we always talk about, you know, their gait, how they're walking, and being safe. I just put this little chart here. This is one from one of the books, a very small book that has been printed about lipedema, the disease they call fat. And here we have a differentiation of lipedema, lymphedema, and sometimes it can be confused with obesity. So there is a new paradigm shift now with the authorities that govern this whole topic of lipedema, that they want to change the name. So there is something new in the horizon for lipedema. They want to call it lipalgia because it is painful fat. So lipo is fat and algia is the pain. But because what's happening is a lot of times you're getting some of the obese patients thinking, oh, this is lipedema, and they want to use that as a reason for, you know, trying to get treatments or some of the surgeries. So they want to differentiate that. And it mostly lipedema is in females, where lymphedema or obesity could be males and females. And the locations of where the lipedema, as you can see, is usually in the lower part of the body. It's in the later stages, it can be in the upper arm. Lymphedema, as we talked about, it could be, lower extremities. It can be anywhere in the body. Same thing with obesity. The involvement of the feet. With lipedema, except in the later stages, there is no swelling whatsoever. You don't have that dorsal hump like you do in lymphedema. And obesity, usually, sometimes you'll see it, but not always. And the sides where it occurs, lipedema is always bilateral on both legs. Lymphedema, it all depends where the damage to the lymph nodes is. Obesity also would be bilateral. Pain presents very much so in lipedema, not usually in lymphedema. It looks like it should be painful in lymphedema when you see that swollen leg, but normally they don't even realize that they have a change going on because there is no pain related with it. And with obesity, not usually. Skin changes. I have to say, most of my lipedema patients have beautiful skin. The texture feels great. Where in lymphedema, there are changes. You start to see that peau d'orange effect where it almost looks like an orange peel. In obesity, as most people know, that you don't see changes unless they're really, really advanced. Stemmer signs, which is the sign that we use in checking lymphedema, where you pinch in between the first and second toe. In lymphedema, it's positive, but you won't find that in lipedema or in obesity. And edema, which is just general swelling, it's not going to be pitting. So the texture of a lipedema patient is actually very soft and supple in comparison to someone who has lymphedema, where you can leave a pitting stage on the lower leg or even the arm. And with obesity, usually that's not present. So this is a nice way of having to compare to see how they all differ. This is the stages of lymphedema. We have 3 stages where it's visible. And I'm going to jump into the next one, then we'll come back. And so the stage 0 is latency stage, where there is subclinical state where swelling is not even evident. You don't see any swelling whatsoever, but yet now with new technology, they're able to measure if there is subclinical stage. And then we go to stage 1, where it's mild. Stage 2 is the moderate stage, and stage 3 is what we call elephantiasis. So as you can see here, and the first one, you have to look very close to realize, and the way you know it is by doing circumferential measurements all throughout the legs and compare both left and right. Here it's a little bit more obvious. You start to see more, and then you start to lose the definition of the joint. Okay, and you do see some on the foot in comparison to the other. In the later stages where it's elephantiasis, and the reason they call it that is because it becomes almost like a tree trunk. The texture almost looks like elephant skin on there, and it's due to fibrosis as a result of the protein that builds up underneath and the fluid that's trapped. So this is lymphedema, okay? And we went through those. Now, lipedema. These are different stages. So we have 4 stages. And as you can see, this is what I refer to as the cuff sign right here, okay? You see that the foot almost looks like it belongs to someone else. And like someone put like a suit on them. And the feet normally are not affected. They're spared in stage 1 to 3. And stage 4, that's where you start to see the dorsal hump. But then also you start to see the medial and the lateral bulges that come on. Just here, stage 1, the skin is normal with enlarged nodules in the hypodermis. Uneven skin in stage 2 with indentations in the fat. Stage 3, there's thickening and hardening of the subcutis with large nodules and protruding fat pads. And then stage 4 is now, because of the lipedema being so advanced, it's trapping the lymphatic fluid, so it becomes lipolymphedema. Okay, so that was my little presentation to help educate and show the differences. And what I see in my office as to how it does it affect balance? Well, as you can see, some of those larger lower extremity, it really shifts your center of gravity when you become very advanced in lipedema. In lymphedema, the fact that maybe one leg is involved, it's going to throw off your balance. And one of the risks with these patients is the potential for falls. And if they already have a compromised lymphatic system and they get a cut or they injure themselves, it's going to take a little longer for them to heal. So with getting these patients treated, making them move a little bit better and improving their overall health, that is our goal, to keep them out of trouble.
Wow, that's really wonderful
Thank you.
presentation. Yeah.
It's,
So I
just,
feel sad a little bit on the pictures though.
yeah, well,
Yeah, it's really sad. Yeah, that's good. So,
did I shut you?
no, I'm good. Yeah, so thank you so much, Anna. It's really a wonderful presentation there. It's
Well,
really
thank you.
explain the lymphedema versus lymphedema. And also you even added the obesity part there. So that's really good because
Right.
most probably our normal individual or people outside, when they saw the lipedema itself and the obesity, I believe, will be the one more difficult to distinguish
And it
because
is.
it's
And
both symmetrical, you know.
yeah. And I can share with you that one of the things is, if sometimes a patient may come in and present with what they think is lipedema, and maybe they read about it or they want to be evaluated, or their doctors don't know what they're looking at. The best way really to assess that is if a patient is able to lose weight with a traditional diet, and if they exercise, that's, the telltale sign that it is obesity, because they can control it. If it's lipedema, it is so resistant because it's so driven by the hormones, that the hormones create all this cortisol and cytokines that actually trap that fat, and it doesn't allow them to lose as easily. So, I mean, we are making some advances now with lipedema. There is a wonderful doctor, Dr. Karen Herbst, who has been doing a lot of research out of, she was at the University of Arizona. And we actually last year were able to get a standard of care for lipedema established by her and her colleagues, in order for doctors and medical school and other therapists and professionals to diagnose it and to address it, because there is an immense need to address these issues, because not everybody that goes to a doctor that has a high BMI means that they're obese. They could be suffering from lipedema.
Oh, good point. Yeah. Even nowadays, you can be obese if you will going to base it in BMI. When you are the strength, the strengthener,
Right.
the bodybuilders.
Bodybuilder.
Yes, the bodybuilders, if you categorize it by BMI, they are already obese, but they are hypertrophy, they are pure muscles,
Pure
not
muscle.
really the
Right.
fats things there. Yeah, so that's a great point. And then how about if ever, what can you say about liposuction in these cases?
Well,
Obesity, lipedema, and liposuction.
sure. So that is one of the treatments, the medical treatments that they can seek when they're ready for it. Liposuction is done by a specialized surgeons. Not every surgeon is equipped to do that with these patients, because you will have to make sure that the lymphatic system is not disrupted any further. So this is a special liposuction that's performed by these surgeons, and I have to say that there's more of a growing population of surgeons coming out and doing this. But for a while, we only had a handful, like 3 in California, 1 in Delaware and Georgia, and now we have some in Florida, Tennessee, and more in the Cleveland area. So uh, we're expanding with that. And what they do is they try to get rid of that diseased fat that is trapped under their skin, and they put them into compression after that. And then
Yes.
usually they are sent to either a lymphatic therapist to get the manual therapy in order to
Mhm.
get the tissue to move. So we do some of the decongestive therapy for them and
Mhm.
put them into garments. Now, keep in mind, because they are so sensitive, they cannot tolerate bandages well, or
Mhm.
even like a pair of 20 to 30 millimeters of mercury socks, which would be something simple for someone with lymphedema. They can't tolerate that. It's too painful. So, in looking at all of this, I have been using with my patients different types of leggings that are called Bioflex or Solidea. They're
Okay.
Italian made, and they have a micro massage material that actually enhances the lymph flow. So that helps them tremendously. And so once they come in after their surgery, we have to implement a little bit of exercise as well. And I can talk about those exercises if you like.
Mhm.
Yeah, so
Yeah. You can share some exercises tips, especially for lower legs and a little bit more on the uppers, because
right.
we have more on lower legs cases of lymphedema. Upper X is more on breast cancer
And
related
breath.
surgeries, something like that. So please do so.
Right. So with let's start with the lipedema. So my toolbox for of things that I give to my patients is usually wearing their compression pants that they have those leggings that are Bioflex or Solidea. They're very helpful, and for them to stay active. And one of the best exercise for this group of patient is aquatherapy. And I'm not talking about go to a pool and swim. I'm talking about doing their exercises in the water. It just relieves a lot of that stress on the joints. And then the other exercise that is really helpful is a rebounder, a mini trampoline. If they could get on it and start
Mm.
slowly, just kind of like bouncing and build it up, that's another tool. Here in the office, I have as well a vibration plate. So I have a commercial size vibration plate, which is a little bit bigger, but they sell vibration plates for home use. That really helps the lymphatic system to work. So if I put my patients on there for at least 5 to 10 minutes for exercise, immediately after that, they feel like they have to go to the bathroom and urinate because that's how you move the fluid. It has to go into the right channel. So those are very helpful exercises that they would do because a lot of times just regular machines in a gym or walking on a treadmill would be very painful for them. And then of course I always discuss with them proper nutrition and things that are more of anti-inflammatory. Some of my patients, I have to say, are doing like a ketogenic diet, and it has worked for them because once uh, you don't have the carbs in your body starts to tap into that lipedema fat in order to use it for energy. So that has worked for them to in order to help reduce some of the weight. And the one thing they all tell me is that they don't feel the inflammation that they once had before. But like I said, anti-inflammatory and ketogenic has been, you know, individually picked for some patients, but each of them is a different and unique individual. So no cookie cutting in this field.
Wow, that's really nice. Thank you so much for all those tips. I like the when you say the vibration plate. In our course, the lymphedema conference that we had a wonderful presentation also with Dan, and we emphasized the manual pump, right? So that
Right,
is on the long run and part of your maintenance. And also we want to specify compression garments.
right,
You say that too, and that is for the micro massaging part of that. So those
right.
are, how about that vibration plate? You put it on a specific part? And how big is that? Like, is that a
Well,
small machine?
it is. It's almost like a, I would say, like a little table that you stand on. It's for standing. So not only does it help, with the lymphatic, it also the stimulation that it creates, the hurt as it vibrates, it helps with your bone loss. If you are osteopenia or osteoporotic, it's a big help on that. Um, so it's a platform that you stand on. And some of my patients, if they're older and they cannot stand on it, I tell them, if you're working from home on the computer, put it under your feet. You could sit and actually have your legs on it, and it stimulates your lymphatic system in that manner. There are other patients that have tried it in sitting. So they put a pillow over it and they sit on it, and it vibrates more of their trunk and torso, and it really helps. So
Ah,
the one I
okay.
have here at my office, it's a bigger one, so you stand on it, and it has little hand weights that you could do with it. It's that's a luxury, but for home they sell, even like Amazon or even Walmart. They have some, and it's
Mhm.
called a vibration plate, and there are different
Yes.
prices.
Yes, so I imagine it now. You remember there is like a small one, like the foot massager. So you
Yes,
just put your foot there, and so that's vibrating their both feet.
that's it.
So that's almost like the effect. Okay, so that's why
That is
it's a vibration. So the plate itself is just like a form, like the foundation where you were going to stand or sit on. All right. And I
exactly
totally agree with the function there or the rationale of vibrating it and everything. But I like your point on the carb diet. I didn't think about that. Yeah. So when they
yeah,
have less carb, they will just use the most fat that was left behind. So that's more on the ketogenic.
right.
So it's more on proteins or thinking those things that's energy. So that's really good. So overall, just like combination of everything diet, skincare, using compression garments, and proper knowledge and following their certified lymphedema therapies. So thank
Right.
you so much, Anna.
Oh, you're
Can you
welcome.
tell us more about you? Any closing remarks that you want to say to our listeners, please?
Yes. Um, Physical therapy is so dynamic, and it covers so many areas. So sometimes I hear even some of my colleagues say, "Oh, yeah, I'm a little burned out." You know what? Change it up. Look into something different. Sometimes you may realize that you were meant to do something a little bit different than just orthopedics or geriatrics. Look into maybe taking a course about lymphatics, see if you like it, and it may open up a whole new channel of life for you and for your profession. And it's also so good to stay aware of all these things, especially in this changing world that we have right now with how things are going. So, keep it fresh. Don't get stagnant in where you are. So I do the same thing with my patients. I keep their knowledge fresh, and I encourage my colleagues to do the same.
Yes. Thank you so much. This is a really wonderful opportunity of learning. And not everybody are aware of what is lymphedema. Honestly, even doctors are not aware of how it works. They just gave Lasix. They just gave medication. And
Right.
then we need to ask. And I like how you emphasize the proper coding, proper documentation, and the challenges of the insurance, and that's really really true with our what's happening right now. So I hope there will be more changes. And then you remember
Yes.
in our course we have the Lymphedema Therapy Act that
Yes.
they are pushing and helping, and they're representing in the Senate, in the Congress, to help our clients or lymphedema patients to able to have those particular compression garments to be paid by their insurance or be covered. So I hope you guys also support that Lymphedema Treatment Act. And then if you
Absolutely.
have, this is a wonderful presentation, but Anna already also did a wonderful presentation last time in the Lymphedema conference and summit. So it's still available, and we can, if you have any idea or want to know more, just connect with us and connect with me and we can give you the copy of those, and then it's still available in our geriatric balance and fall support group. All right. So thank you so much, Anna. And
Thank
again,
you.
how can we connect with you? Any emails or website that they can check on you?
Yes, I am Omnitherapy Center LLC on Facebook. I am also under my name, Ana Pozzolli, on LinkedIn. And our email is omnitherapycenter@comcast.net. So if you have any questions, or just feel free to reach out. And if you're interested in the field and even want to spend the day here watching some of the treatments, I encourage some of my colleagues to do that.
Wonderful. Thank you so much. So to all who are listening right now, if you are a lymphedema patient, if you see that the pictures that you just see looks like your legs, or you know somebody who has something closer to that, so we have a now it's a new education for you that it is a lymphedema or a lipedema. Connect with your lymphedema therapist in your area. Check with your doctor that I think this is it. And then if you are in New Jersey, Pennsylvania, Philadelphia, based in Delaware, connect with us and Anna, and she has a clinic in New Jersey. It's a proper education. It just needs some understanding and knowledge, and we can help and direct you. Okay, guys? So for if you are clinicians and want to know more, we still have that summit, and then connect with us. We can sell it to you and you can give it to your patients for free, you know? So thank you so much, Anna, and God
Thank
bless
you.
you. You
Thank
are
you.
doing great things for our clients. And to all of you guys, if you have any questions, connect with us. It's me again, Dr. Jenny Yusuf, physical therapist and Dr. Physical Therapy. Check with us in Balance and Fall Support Group, Physiogen PT and Wellness. I am your geriatric coach and mentor. If you have any questions, let us know and we will be here to help. All right. God bless everyone.
Good
Thank you,
night.
Anna. Good
Thank
night.
you for the opportunity.
You
Good
are
night.
welcome. Bye, guys.